Boris Johnson is not averse to taking risks, and not for the first time, he's leading the UK into new territory. This time, it's on COVID.
If we can't reopen our society in the next few weeks, when we will be helped by the arrival of summer and by the school holidays, then we must ask ourselves, when will we be able to return to normal?
Very soon in England, the COVID restrictions look likely to be gone, all while the UK's infection rate looks like this, and with numbers likely to rise.
As we predicted in the roadmap in February, we're seeing cases rise fairly rapidly. There could be 50,000 cases detected per day by the 19th.
Boris Johnson's strategy begs many questions. Let's work through them with the government response to each, starting with why you would do this now.
It's very unusual to basically unlock a situation and resort to having no measures in place to prevent the escalation of an infectious disease epidemic or pandemic at a time when you've got increasing numbers of cases in the country.
Dr. McDermott calls it unusual. The opposition has another word for it.
To throw off all protections at the same time when the infection rate is still going up is reckless.
But the government has an answer to this, and it lies in this graph. Here we see rates of hospitalisation during the second wave before the vaccine, and then right now with many people vaccinated. Hospitalisation rates are far lower, as the government points out.
Our vaccines are building a wall of protection against hospitalisation, and jab by jab, brick by brick, that wall is getting higher.
OK, but if the vaccine's working and 65% of adults are fully vaccinated, the next question is, why not finish the job first?
We're about 3/4 of the way through our vaccination programme. I'd like to finish it before we go all the way to opening.
On this point, Boris Johnson has this message.
To those who say we should delay again, the alternative to that is to open up in winter when the virus will have an advantage, or not at all this year.
Mr. Johnson believes the summer weather and the school holidays can reduce the impact of dropping the restrictions, and he has support from some leading scientists.
I wouldn't say it's a sweet spot, but the 4-week delay we have gone through and has been worth it, and the benefits become somewhat less after that.
I do think the government are right. I think it's time, we're in the summer, I think it's time to start releasing and trying to get back to some sort of normality.
As well as that, here's England's Chief Medical Officer, Chris Whitty, on the idea of waiting further.
At a certain point, you move to the situation where instead of actually averting hospitalisations and deaths, you move over to just delaying them.
There are other concerns about the government's plan too. Here are two more from Professor Christina Pagel again.
Infections still matter. They matter because about 10 to 20% of people end up with long COVID, which can be quite debilitating. They matter because every infection is a new chance for a new variant to arise.
Let's take those points in turn. On long COVID, well, Chris Whitty says, since there's a lot of COVID at the moment and the rates are going up, I regret to say I think we will get a significant amount more long COVID, particularly in the younger ages where the vaccination rates are currently much lower. There is an acceptance more people will get long COVID. The next point from Christina Pagel is the risk of new variants evolving. Well, we've no specific government response on this, but here's Professor Anthony Harnden again.
It's likely that immunity will last for a long time, and it's likely that even if new variants arise, there will be some degree of protection.
The government calculation is that vaccines can cope with whatever comes. There is, though, a further broader question, whether the government is risking people's health for the sake of the economy. Well, the Health Secretary, Sajid Javid, answered that in the Mail on Sunday. The headline reads, "The economic arguments for opening up Britain are well known, but for me, the health case is equally compelling." And Mr. Javid writes, because of the pandemic, we estimate that about 7 million fewer people than normal came forward for healthcare. Now, that COVID has disrupted other healthcare is accepted. Whether the government's decision this week addresses that problem hinges on what happens to those hospitalisation rates. Here's Professor Neil Ferguson again.
The challenge is there's still the potential of getting very large numbers of cases. And this is the the million-dollar question, if we get very high numbers of cases a day, 150,000, 200,000, it still could cause some pressure to the health system.
That indeed is the question, or at least one of them. Another is where politics fits into this. Certainly, to some degree, this is about the Conservatives' desire to assert individual responsibility and freedom.
What we're doing, Mr. Speaker, is cautiously, prudently moving from legal diktat to allowing people to take personal responsibility for their actions.
Now, to some observers of Boris Johnson, this is familiar territory. The political journalist Steve Richards has tweeted, "At every junction of the pandemic, the beginning, last September, Christmas, Johnson has followed his libertarian instincts in full. Here we go again," says Steve Richards. Now, Boris Johnson himself has talked of a reluctance to use nationwide restrictions, for them to be the last resort. He's also talked of how British common sense is essential to navigating this pandemic. So his decision this week is not necessarily a surprise. There are, though, concerns about the limits of common sense.
It's just like driving. My freedom to drive fast affects your safety. My freedom not to wear a mask affects your safety in terms of not getting COVID. And in areas like that, we recognise that we do need some level of regulation.
So there's an argument that rules encourage us all to act responsibly. There's also concern that without them, the burden of this pandemic is placed on the most vulnerable.
For shielders like myself and for many, many other disabled people across the country, we will remain in place, will remain shielding and will remain isolated just so we can protect ourselves.
The government does not dismiss these concerns, but its message is that society as a whole has to start to learn to live with COVID while still being cautious. And if all of this is partly about political philosophy, about personal freedoms, it's also about straight politics too. Tom Newton-Dunn of Times Radio reported ahead of the announcement that ministers concede they no longer have enough Tory MP support to keep restrictions any longer. And here's one MP responding approvingly to the decision on masks.
I think it is an infringement of civil liberties. I think it is right to return to people a degree of autonomy about the way that they live their lives.
And so for all the reasons I've been through, politics and science are intertwining in this decision. And the WHO reminds us the stakes on it are high.
We would ask governments to be really careful at this moment, not to lose the gains you've made, to open up very carefully.
The government knows this is a decision with risks attached. It knows when the infection rate rises, when homes, trains, pubs, offices and shops are full of people not wearing masks, this will be living with COVID. And only then will the health service, the economy and the virus show us if that was the right decision.